our future. The next question that I wanted to pose to the panel is the opportunities that you see for NZNO in the future, or the opportunities that you see for nursing in the future. So, Dame Margaret, are you happy if we start with you again?
Yes, I'm happy to lead. The one thing that I've wondered about, and I should have mentioned earlier, I've come back into nursing I suppose it's about the last 10 years, as patron of the mental health nurses, the College of Mental Health Nurses. So that's brought me, given me insight into what is going on in that field, and it's also a source of great admiration for what has actually happened from the days when I trained on the wards of a mental hospital to now rubbing shoulders with people who have got masters and doctorates and do all sorts of interesting research. So that's a great joy to me. But the one thing that I've wondered about is while we're advocating, I've always seen that the nurse has a very special role to advocate for patients, that they have a closeness to the patient and an understanding of their life and their social situation in a way that I don't believe other professions very often see, because they never get that time and closeness with people. And I've always wondered why we don't extend that. Why I don't think we always advocate for the patient as we should, even today. And even though nurses are much better prepared for that. But I also wonder why we don't advocate for the health issues that we know about. And often, I can remember when I was Director General of Social Welfare, one Christmas I was asked to do an article to fill in space in the media, which was usually done by ministers, and our minister didn't want to, or was going away, and so he asked me to do it. And so I told the story as I saw it, which was that we were going into meeting families where young kids going to school, when you ask someone what they wanted to be, they told you they wanted to be a beneficiary. Where, in my day, they told you wanted to be a fireman or a nurse or something. And I found that really disconcerting. And so I told the reporter this, and they put it in the paper that here were children going to school aspiring to be beneficiaries. And it caused quite an uproar, and it caused an even bigger uproar for me. The Prime Minister was absolutely furious, and I was left in no doubt that wasn't appreciated that I'd actually told it as it was. And I just felt that the public needed to know, that be concerned that little kids were growing up in such a limited horizon, that they saw being a beneficiary as a career path. So I never ever forgot the telling off I got over that. And I see that in the mental health field, that I have a bit of an insight into what is, the current issues. And I've been surprised that the nurses haven't been more forthcoming, particularly in the last 2 or 3 years, in terms of what's happening in mental health. I know that from my associations with the college, and also from people I'm still friendly with, that everyone who works in the mental health field talks to me about the impact of P and what that's meaning in terms of mental health. The general public don't know that. And, I think that who's going to tell them? We've almost got this code that we don't tell what's not nice, or that we are the keepers of what we keep under the blankets, rather than telling. And I think that nurses have an opportunity and probably a responsibility to broaden their field in terms of advocating for health as well as for the patient, because no one else is going to do it. And so you've got, thousands and thousands of people with mental health issues, and the general public has no idea of the epidemic that's at the basis of a lot of that illness. And so we all go blithely on, believing it's all sweetness and light, where it's, terrible tragedies in thousands of people's lives. But there'd be many more areas as well. So that's my hobby horse.
Thank you very much. And that's a very clear challenge to our organisation, and part of what we need to certainly have some further discussions about. Not just the pandemic, but actually the epidemic that exists within our health conditions currently, and the intergenerational poverty, and how do we advocate for social determinants of health and well-being if we're not proactively there. I think it goes back to a little bit, and this is probably something that we can ponder about when we talk about the voices of nurses, and our history is deeply entrenched in being ladylike. Is it not ladylike to talk about the hard things, to talk about the real issues? And that's probably something that we need to do a bit more work around, being savvy and to really advocate for the real issues. Thank you, Dame Margaret. Beverly.
Yes, well, I too, like Ash, was very saddened to read of the discord between the NZNO board and membership at the moment over recent events. NZNO is a membership-driven organisation. We own it. We elect members to the board in good faith, and we expect them to be honest and transparent because we have trust in them as our representatives. And so it's very upsetting and disheartening to read of what's happening. And I do wish the board all the best going forward, and hope that these issues can be resolved and we can move forward as an organisation. I know that as a long-standing member, I find sometimes communication could be improved. The use of social media for offshoots or splinter groups is fine, but a lot of it is very negative comments. And I think what we need to get out there and communicate to our members of what we're doing well, and put a positive spin on everything. Because that's what members, they look to the organisation for leadership and guidance. And if they're constantly hearing back from colleagues negative criticism, it can be very despondent for them. And so I think we need to counter that with the positive things that NZNO is doing. There are many, many positive things. I have been at national meetings up in the office, and I see how very hard the staff work for the betterment of nurses. And so I, think we need to come together and unify in this area. I would also like to talk about a little bit pick up what Dame Margaret was saying about advocacy. And I had also thought about, we used to have quite a lot of publications on NZNO policies. Guidelines for practice, especially in specific areas, and also guidelines for nurses not actually always giving a strong viewpoint, but allowing nurses to work within a framework. And I'm not sure if these policies are still around or if they are continually being updated. but I think it's very useful. I hear back from other colleagues in other health practices that, you know, for example, when COVID erupted, their organisation came out with specific policies of how they were to operate rather than leave it to their workplaces to do. And I think in this organisation, we can lead and support and guide nurses in these directions a little more. But my two pet subjects going forward would have to be looking after our new graduates and education. I'm very passionate about these two, and I realise I just have a small time frame, so I shall get on without further ado. We are not good at nurturing our new graduates. You know, I become very dispirited when I see health managers overlooking new graduates to employ the likes of CAP students. Now, I have nothing against our overseas nurses at all, but we must look after our own first. Now, we have trained them. We need to nurture them, support them, and guide them through those first years out of their nursing training. You know, I was so fortunate that I had excellent role models who nurtured me as a new midwife. And, you know, I like to think that because of that, I'm able to give back. Because I always remember when I see a new grad, I think, ah, yes, I know what you're going through. This is what you need. And teaching and nurturing should be just part of being a nurse. It should be just inbuilt into us. And it's very discouraging when you see nurses that come through their training and then take off immediately overseas, never to be seen again. Now, I'm not saying that once we have put them through a kind of new graduate program or whatever, that they still don't want to go overseas. That's part and parcel of life for the young ones these days. But, you know, hopefully what we've embedded into them will continue throughout their nursing career. And you've started them off on a track, and it doesn't matter where they are nursing, you know that you've done your best for that person. And so, you know, we must, I think, look after our new grads. I think NZNO can be instrumental in this, and that they can perhaps encourage managers, and a lot of them are nurses that are in these management positions, to look after our workforce first and see to them. The second one of my passions is education. You could never undervalue the value of education. And I see that eroded time and time again. And it's usually when you're looking at wage negotiations, education leave is one of the things that drops off the negotiating table first, because it's not seen as a priority compared to shift allowance or other issues. But I'm very, very passionate that if we have an educated workforce that are able to attend lectures, keep themselves updated on the latest research and NZNO policies, you know, we have a well-rounded workforce that can be competent going forward. I would like to see that education packages are put back on the negotiating table and to become part and parcel of any negotiation, as it is for our medical colleagues. They have very good education supportive packages, and I would like to see our nursing staff have the same privileges as them. So those are the opportunities I see. And as you can see, my focus is from a clinical base. And so therefore, I'm inclined to think what is appropriate for the nurses in clinical practice from NZNO.
Thank you, Beverly. Just like Dame Margaret, you've thrown out some significant challenges, of which I'm also going to ask Mairi when we conclude the panel to provide some insights on, especially since that's part of her area of specialty and leadership. But certainly the advocacy, the not forgetting the new graduates, we need to have succession planning continue on. But we also, as nursing, and not just nationally, but internationally, we do have a culture of being seen to be bullying or eating our own. So some of that is dispelling that and having some proactive steps around supporting and nurturing and being that kind professional group that we are. So I'll let Mairi pick up on some of those amazing challenges that you've given, but I'll go to Ash in the meantime.
I'd just like to tautoko what Beverly said about nurturing new grads and even more so the students as well. Having just come off practicum, I feel incredibly privileged and incredibly grateful to have been on practicum in our co-pup ward. My experience there is, I couldn't rate it any higher. I felt incredibly supported. It's like one big whānau, and it's the exact environment that a student needs to learn in. And I know from speaking with other students that were not in our ward, that there is still that, as you said, Kerry, that eat your young, which I was saddened to hear, given I had such a positive experience. So by all means, I definitely support that continued nurturing of the new grads and the students, as we are the future. We are the future workforce. So just going back to opportunities for NZNO, I just want to speak very briefly to my opportunity as a successful applicant for the new ICN Student Steering Group, and just the opportunities to raise our voice, both as students and as an Indigenous person, on an international scale, and just have that influence in politics and advocating for change for the future, because this is our future and the future of our tamariki and our mokopuna. So yeah, as students, we are the future of nursing, and our ability to affect change and improve the health outcomes of our people is as strong as our voice. And so it will take that collective and collaborative approach to ensure that we are our future leaders in the health and nursing workforce.
Ash, I wondered, did you just want to give some insight into the challenges that you've got right now because of COVID, clinical placements, and just the additional burden that is on students right now because of the difficult way or the unusual way in which you're having to navigate COVID restrictions, placements? Did you want to just give us a brief glimpse of that?
Yeah, sure. I think one of the biggest things for us has been the move from face-to-face to online learning. While it's great to have that flexibility and to still be able to continue with our learning, I know particularly for us as Māori, we learned through that face-to-face interaction and that real practical hands-on, and just through discussions. And while Zoom does provide an opportunity for those discussions, it's a bit more difficult to manage. And I know personally, I'm also someone that likes to get on the whiteboard and just sort of draw and explain things to help really process and understand different concepts, different terminology. So yeah, that's been one thing, but also I know, particularly for year threes, the challenge has been around placement and ensuring that they meet their required clinical hours in order to be able to sit state in November. And I think there has been some differences by region, and I say that particularly for the Bay of Plenty because our mental health placements were delayed due to there being some positive cases of COVID within our mental health department. So what that meant is that those students that still needed to meet their mental health requirements in terms of clinical hours were unable to do so as per the schedule, which would have them sitting state in November as normal. However, as they've been delayed, they're now sitting state in January off the top of my head. So there has been that delay, which further means that they'll be again delayed for net P placements. So instead of going out in January, if successful, they wouldn't be able to commence a placement until March. But I think for the most part, schools have had good communication and have been reasonably proactive with this, because obviously it's out of our control, and we have to find a way to be able to continue with our studies where possible. Recently, from the DHB, they have just stated that year threes are now considered essential workers, so they will no longer be pulled out of placement if they're year three, which allows them to continue forth, particularly given the recent lockdown again up in Auckland. So that's positive. I guess it's been a learning experience, and I think for the most part we've had incredible support. I know certainly in our region from Te Rūnanga and NZNO, and within our student committee, our NZNO student committee, we've all been incredibly supportive of one another, looking at how to navigate these times, these challenging times.
Thank you, Ash. Thank you for your contribution. I think that's really quite significant because it shows the adaptability of the educators to recognise that these are challenging times and how do we respond and still keep the flow going on without disadvantaging too much the impact or the journey of nurses through this.